Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about too scared to allow others to touch you. You might have Haphephobia. Everyone is afraid of something. Some people, however, have unusual and bizarre phobias, one of which is Haphephobia, or the fear of being touched. The fear and anxiety of being touched, known as Haphephobia, can drastically affect a person's life. This phobia falls under the category of specific phobias, which cause a person to be scared of a particular thing or circumstance. People who have this phobia frequently experience symptoms including anxiety, unease, sweating, and sometimes panic attacks when they are touched by others. Haphephobia can elicit the same symptoms as other phobias, including nausea, hyperventilation, heart palpitations, fainting, and self-reactions including crying, shaking, running away in terror, or even stiffening the body in response to dread. Some patients may be terrified of being touched by everyone, but some patients may only be terrified of the other sex. Therefore, not just anyone can interact with them physically. Living a normal life is challenging for those who have this illness, especially if a large number of people are involved. Additionally, it might generate misconceptions when other people try to grasp the illness, particularly when they are just getting to know each other. The patient must therefore receive treatment in order for their quality of life to once again improve. Why does Haphephobia occur? This fear of contact may have its roots in trauma, as is the case in the majority of cases. The explanation is that because their minds are so preoccupied with creating associations throughout their lives, touching or being touched is typically associated with a very painful experience. They typically have a very little personal space, so touching oneself is typically seen as an invasion of one's privacy. The reason the patient fears being touched could possibly be that they have experienced horrifying sexual assault, abuse, or violence. In minor situations, the fear of touch with other people may evoke a disgust response, causing the patient to avoid or deny contact. How may Haphephobia be handled? According to the Mayo Clinic website, untreated certain phobias might result in complications. First, sufferers often practice social isolation, which leaves them feeling lonely and causes issues with their relationships, employment, and schooling. In actuality, they struggle to acquire social skills like other youngsters their age. Additionally, they are highly susceptible to various mental ailments like depression and other anxiety disorders. They may abuse drugs or develop an alcohol addiction as a result of the stress of dealing with their phobia. Furthermore, the risk of suicide increases with the severity of the disease. Given the negative repercussions that result from fear of contact, this disorder needs to be treated right away. Faster handling, easier treatment. The following are Haphephobia remedies that your doctor might suggest. 1. Psychotherapy. The first line of treatment for those with specific phobias is this therapy. Patients typically receive either cognitive behavioral therapy (CBT) or exposure therapy to help them overcome their fears. The goal of exposure treatment is to assist the patient in altering how they react to their worries. These facts and circumstances are presented to the patient repeatedly and gradually during this therapy. Patients may benefit from this frequent exposure in managing their anxiety. In cognitive behavioral therapy, exposure treatment is used in conjunction with other strategies to assist patients in overcoming their phobias. Patients will once again comprehend that not all touch is nasty, disgusting, or dangerous during this therapy. Additionally, the patient will learn how to lessen avoidance of or resistance to contact. 2. Medications. In general, therapy is a very effective Haphephobia treatment. However, there are times when doctors will recommend certain drugs, particularly for individuals who exhibit panic attack symptoms. Drugs are divided into two categories by doctors. Beta blockers are used to counteract the stimulating effects of adrenaline, which can produce palpitations, a rapid heartbeat, high blood pressure, and trembling tremors. Benzodiazepines and other sedatives can help lower anxiety. Patients should not utilize this medication over an extended period of time, and a doctor's prescription is required. However, it is advised to avoid this medication if a patient has a history of alcohol or drug addiction. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.